My name is Zahra. I was diagnosed with hereditary angioedema, or HAE, in 2010. I had my first attack when I was 2 years old. My dad told me that my face was so severely swollen that I was almost unrecognizable. Throughout my life, I was misdiagnosed. Doctors said I have allergies, and I do have a lot of allergies. But in 2010, my throat actually swelled up, and I was taken to the emergency room where it completely shut off, and they had to put a trach down my throat because I stopped breathing. It was very difficult growing up, especially playing basketball or doing daily activities. It could trigger a swelling or an attack. I love to cook, especially now during fall, like with soup season. I love making soup, and growing up, it was just one of those comfort foods, especially when I had an abdominal attack. I would follow my mom's recipes. She would make really good chicken corn soup, so I would make that, and just that act of stirring that pot of soup, that would trigger swelling on my hands. Walking, that would trigger swelling on my feet. But sometimes stress would bring on a swelling. There's an important event coming up. It felt like you're always living on the edge, like waiting for the next attack to happen. I was on an IV therapy. It helped me with my episodes, like the frequency of them. The hardest part on that therapy was getting an IV started. When I was first diagnosed, my husband trained to administer it at home, and we did that for several years, but it was getting difficult to find a vein because of all that scar tissue building up. We ended up going to an infusion center. Every 3 days I would have to go get my treatment done there. Living in Iowa, especially in the winters, you just have to kind of brave through, and that was really hard. When I went for my 6-month checkup, my allergist told me about this medication called HAEGARDA, and she thought it would be a perfect fit for me since it's subcutaneous. It's just so convenient. I can just take it with me wherever I go and have to depend on anybody and travel. It makes you just so much more independent and free. What made me try HAEGARDA was that it's the same protein that my body is lacking that's being replenished. I can easily just do it on my thighs or my arms by myself. My doctor mentioned that some people experience dizziness, injection site reactions such as pain, redness, or swelling, itching and rash, and nasal symptoms, including stuffy or runny nose and sneezing. All my life, I felt like I was always living on edge, waiting for the next attack to come on. Taking HAEGARDA, I feel like I have this new sense of freedom. I've had 0 attacks, and I have all this time that I feel like, I can do this. Prior to therapy, I was having at least 3 to 4 attacks per month. Since starting HAEGARDA, I haven't had to use my rescue medication, which is amazing. I still make sure to carry rescue medication with me wherever I go, just to be safe. But I'm so grateful that I haven't had to use it. So now I'm not afraid to cook as much as I like or bake without having to worry that, you might have an attack. I can do that freely. People struggling with HAE, I would say you have to advocate for yourself. If you have a good support system that will help you, that's so important. I don't want you to give up. You will get through this. There is hope, and keep faith because it will get better. HAEGARDA has given me the possibility of getting through the whole year without an attack.
Now here's some important safety information that you need to know about HAEGARDA.
HAEGARDA, C1 Esterase Inhibitor Subcutaneous Human, is an injectable medicine used to prevent swelling and/or painful attacks in patients 6 years of age and older with hereditary angioedema, HAE. A healthcare professional can teach you or caregiver to self-administer HAEGARDA for prophylaxis. Do not use HAEGARDA to treat an acute HAE attack once it starts. Work with your physician to plan for attacks if they occur. Do not use HAEGARDA if you have previously experienced life-threatening immediate hypersensitivity reactions, such as shock to HAEGARDA or other C1 INH products. Immediately report any symptoms of allergic reactions to HAEGARDA, including hives, chest tightness, wheezing, difficulty breathing, turning blue, faintness, facial swelling, and fast heartbeat. Before starting HAEGARDA, tell your healthcare provider about all medical conditions you have, including pregnancy or nursing, a history of heart disease or stroke, an indwelling catheter or access device in a vein, or immobilization for a sustained period. Also tell your physician about any other medications you're taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. High doses of C1 INH have been known to increase the risk of blood clots. Immediately report to your physician or an emergency room if you have any of the following symptoms of a blood clot: pain or swelling of arm or leg, with warmth or discoloration over the affected area, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, rapid pulse, and numbness or weakness on one side of the body. In clinical studies, the most common side effects reported with HAEGARDA were injection site reactions, pain, redness, swelling, hypersensitivity, itching and rash, dizziness, and nasal symptoms, including stuffy or runny nose and sneezing. These are not the only side effects possible with HAEGARDA. Tell your healthcare provider about any side effect that bothers you or does not go away. Because HAEGARDA is made from human blood, the risk that it may transmit infectious agents, including viruses and, theoretically, the agents of Creutzfeldt-Jakob disease, CJD, and its variant form, VCJD, cannot be completely eliminated. Please see full prescribing information for HAEGARDA, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.